Why does insulin cost $10 in Canada, but over $300 in the United States? This stark disparity highlights a critical issue. Prescription drugs in the U.S. are among the most expensive in the world, creating a profound burden. In this comprehensive analysis, we will explain why Americans pay so much more for essential medicines and explore the devastating implications for patients, healthcare systems, and the nation's economic health. Americans consistently pay 2 to 3 times more for prescription drugs than patients in other developed countries. This isn't just about luxury medications. It includes life-saving drugs like insulin, EpiPens, and critical cancer treatments. The sheer scale of this price difference is not only economically unsustainable, but also morally concerning, raising fundamental questions about access to healthcare. Consider the average cost of a common medication. A drug that might cost $50 in Germany or the UK could easily be $200 or more in the US. This gap isn't a minor fluctuation. It represents a systemic divergence in how drug prices are determined and regulated. Understanding this anomaly is the first step toward addressing it. This significant price disparity directly impacts patient adherence and health outcomes. Many individuals are forced to choose between essential medications and other basic necessities, leading to tragic consequences. The economic burden extends beyond individual patients, affecting employers, insurers, and government healthcare programs. One major reason for exorbitant U.S. drug prices is the absence of national price negotiation. Unlike virtually every other developed nation, the U.S. government does not bargain directly with pharmaceutical companies. This unique approach leaves drug manufacturers largely unchecked in setting their prices. In countries like Canada, the UK, France, and Germany, governments or national health agencies leverage their collective purchasing power. They negotiate bulk discounts, set price caps, and often conduct health technology assessments to determine a drug's value. This robust negotiation process ensures that drug prices reflect a balance between innovation and affordability. The U.S. system, particularly Medicare, is legally prohibited from negotiating drug prices for its vast beneficiary population. This provision, enshrined in the Medicare Part D prescription drug benefit, effectively cedes pricing power to pharmaceutical companies. The result is a fragmented market where individual insurers or pharmacy benefit managers, PBMs, negotiate, but without the unified leverage of a national buyer. This lack of negotiation means that pharmaceutical companies can charge what the market will bear, rather than what is deemed a fair or sustainable price. It creates an environment where drug prices are often set based on perceived value and market demand, rather than production costs or global benchmarks. For patients, this translates directly into higher out-of-pocket costs and greater financial strain. Pharmaceutical companies heavily rely on patents to protect their intellectual property and ensure market exclusivity. While patents are crucial for incentivizing innovation and research, their application in the U.S. drug market often extends beyond reasonable limits. This allows companies to maintain monopolies and keep prices artificially high for extended periods. A common tactic is evergreening, where companies make minor modifications to existing drugs. These small changes, such as a new dosage form or a slightly altered chemical compound, can secure new patents. This effectively extends the period of market exclusivity, delaying the entry of lower-cost generic alternatives for years, sometimes even decades. Beyond traditional patents, other forms of exclusivity also contribute to high prices. Data exclusivity, for instance, prevents generic manufacturers from using a brand-name drug's clinical trial data for a set period. Orphan drug designations, intended to encourage development for rare diseases, can also grant extended market exclusivity, even for drugs that later find broader use. This intricate web of patent protections and exclusivity periods stifles competition, which is a fundamental driver of lower prices in other industries. Without robust generic competition, brand-name manufacturers face little pressure to reduce their prices. This system prioritizes corporate profits over patient access and affordability, creating a significant barrier to healthcare. The United States is one of only 2 countries in the world that permits direct-to-consumer (DTC) advertising for prescription drugs. New Zealand is the other. This unique allowance leads to billions of dollars being spent annually on television commercials, online campaigns, and print advertisements. These substantial marketing costs are ultimately passed directly to consumers through higher drug prices. Pharmaceutical companies invest heavily in sophisticated advertising campaigns designed to create demand for their products. These ads often highlight symptoms and suggest specific brand name solutions, encouraging patients to ask their doctors for particular medications. While proponents argue DTC advertising informs patients, critics contend it can lead to overprescription and a focus on expensive brand name drugs over equally effective, more affordable generics. Beyond direct advertising, pharmaceutical companies also spend vast sums on lobbying efforts. These activities aim to influence legislation and regulatory policies that affect drug pricing, patent protection, and market access. This significant financial influence in Washington, D.C., helps maintain the status quo, where drug companies retain considerable power over pricing. The combined effect of extensive marketing and powerful lobbying creates a self-reinforcing cycle. High advertising costs are built into drug prices, and lobbying ensures policies remain favorable to high prices. This system prioritizes commercial interest over public health, contributing significantly to the U.S. outlier status in drug costs. Pharmacy benefit managers, PBMs, play a complex and often opaque role in the U.S. drug supply chain. PBMs act as intermediaries between drug manufacturers, pharmacies, and health insurers. They manage prescription drug benefits for millions of Americans, negotiating rebates with manufacturers and creating drug formularies. While PBMs claim to lower drug costs through negotiation, their practices have come under increasing scrutiny. The rebates they negotiate with manufacturers are often not fully passed on to patients or even to health plans. Instead, a significant portion may be retained by the PBM, contributing to their profits. This lack of transparency makes it difficult to ascertain the true net price of drugs. PBMs also influence which drugs are included on an insurer's formulary or list of covered medications. This can sometimes lead to preferred placement for higher-priced brand-name drugs that offer larger rebates, even if more affordable alternatives exist. This system can incentivize higher list prices, as manufacturers may offer larger rebates on more expensive drugs. The intricate financial relationships between manufacturers, PBMs, and insurers create a convoluted pricing structure. This opacity makes it challenging for policymakers and the public to understand where costs originate and how they are distributed. Addressing drug pricing effectively requires greater transparency and reform within the PBM industry. For millions of American families, the exorbitant cost of medicine is not just an economic burden, it is a devastating crisis. Patients are frequently forced to make impossible choices: ration doses, skip refills, or forego essential medications altogether. This leads to worsening health conditions, increased hospitalizations, and, tragically, preventable deaths. The financial strain often pushes individuals and families into crippling medical debt. Even with insurance, high deductibles, copays, and coinsurance can make life-saving drugs unaffordable. This creates a system where access to vital medicine depends not on medical need, but on the size of one's wallet, fundamentally undermining the principle of equitable healthcare. Beyond the physical and financial toll, there is a profound psychological impact. Patients and their families live with constant anxiety about affording their next prescription. This chronic stress can exacerbate existing health conditions and diminish overall quality of life. The current system disproportionately affects vulnerable populations, including the elderly, those with chronic illnesses, and low-income communities, exacerbating health disparities. These are not abstract statistics. They represent real people facing unimaginable hardship. Stories abound of individuals cutting pills in half, sharing medications, or traveling abroad to access affordable drugs. This human cost underscores the urgent need for systemic reform, as the current situation is unsustainable and morally indefensible. The growing public outcry and the undeniable human cost have spurred significant debate and some legislative action. Policy changes are slowly being enacted, aiming to address the long-standing issue of high drug costs. These efforts represent a crucial step toward a more equitable and affordable healthcare system. One notable development is the Inflation Reduction Act, IRA, of 2022. This landmark legislation includes provisions that allow Medicare to negotiate prices for a limited number of high-cost drugs. While the scope is initially narrow, it marks a historic shift, breaking the long-standing prohibition on Medicare negotiation. The IRA also caps out-of-pocket prescription drug costs for Medicare beneficiaries, providing much-needed relief. Beyond federal action, various state-level initiatives are also emerging. Some states are exploring drug importation programs from Canada, where prices are significantly lower. Others are implementing prescription drug affordability boards to review and set upper payment limits for certain medications. These diverse approaches reflect a growing determination to tackle the problem from multiple angles. However, significant challenges remain. Pharmaceutical companies are vigorously opposing these reforms through legal challenges and lobbying efforts. The path to comprehensive change will be long and arduous, requiring sustained political will and public pressure. Future solutions may include greater transparency in the drug supply chain, value-based pricing models, and stronger incentives for generic competition. The question of why prescription drugs are so expensive in the U.S. is complex, rooted in a unique confluence of factors: the absence of national price negotiation, extended patent protections, aggressive marketing, and opaque supply chain practices. This system has created an unsustainable burden on patients, families, and the entire healthcare system. It is a system where access to life-saving medicine is often dictated by financial capacity, not medical need. We must recognize that this is not merely an economic issue. It is a profound public health crisis and a matter of social justice. Every individual deserves access to affordable, life-saving medication. The current trajectory is unsustainable, leading to preventable suffering and exacerbating health disparities across the nation. What do you think? Should the U.S. government negotiate drug prices like other developed countries? Do you believe the current system adequately balances innovation with affordability? Share your thoughts and experiences in the comments below. Your voice is crucial in this ongoing dialogue. We urge you to engage with this critical issue. Educate yourself further, discuss it with your elected officials, and advocate for policies that prioritize patient well-being over corporate profits. Support organizations working to lower drug costs and ensure equitable access to healthcare for all. Don't forget to subscribe for more in-depth analyses on healthcare, business, and technology. Together, we can push for a future where essential medicines are a right, not a privilege.